Hi, my name is Rick Olderman. I'm a physical therapist and anesthetics practitioner, and I'm talking to you about carpal tunnel syndrome and thoracic outlet syndrome. Hopefully this will get you on your way. What is carpal tunnel syndrome? Well, it's just numbness and tingling and weakness in your hand because of compression of the median nerve, usually through the carpal tunnel, which is at your wrist. Pronator Teres syndrome mimics this to some extent, and you'll see that in just a second here. So here's the median nerve. It's coming down and it's running through, and it runs underneath the sheath of tissue here, and that's where the compression is. This is the carpal tunnel. So it gets compressed here and then causes numbness and tingling in these fingers and in this part of the hand, and weakness too. So here's the pronator teres right here, and so because it runs underneath or even maybe through in some of you, compression or tension in the pronator teres can cause carpal tunnel syndromes as well. And this is the distribution of the hand that you would feel carpal tunnel syndrome in typically. All right, so there are other things that can cause these symptoms as well. Arthritic conditions, gout, even endocrine gland like a pituitary hypothalamus type of thing. These disorders can mimic carpal tunnel syndrome. Now, if this would typically be in the case if you have carpal tunnel syndrome in both hands, then you might want to get tested for pituitary or other endocrine gland dysfunction that may be contributing to this in you. Now, let's revisit this idea of the pronator teres again, because I found that this is a huge instigator of problems. You see this pronator quadratus too? Both of these are pronators. And the pronator quadratus, you'll see, is very close to where that carpal tunnel is. So what I have found in a lot of people with carpal tunnel syndrome is that these muscles are very tight and contracted. And if we just simply stretch them out, it relieves a lot of tension along that median nerve and helps the carpal tunnel syndromes. And we may have to affect other things too throughout the shoulder. But if you have carpal tunnel syndrome in one hand, this would be where I would definitely pursue the forearm rotator stretches that I have in the clinic. Let's talk a little bit about thoracic outlet syndrome. What is that? Well, it occurs when the blood vessels or nerves in the space between your collarbone and first rib become compressed. It's called your thoracic outlet. Here's a picture of it. So here's the blood vessel, here's the collarbone, here's the first rib, and the space here just gets too compressed, all right? And we have an anterior scalene, which is often a culprit, found to be a culprit in irritating all of this structure, okay? But I want you to pay attention to one thing here. This is the collarbone, and it is part of the problem. But I want you to understand that the collarbone is attached to the shoulder blade. This is the shoulder blade right here. It's the front of it. So this becomes, in my opinion, a big stressor to the thoracic outlet syndrome issue. And you'll see why in just a second. So here's the shoulder blade from the back, and there's the collarbone going around to the front, and the first rib to compress the first rib. So if the shoulder blade is not working well, it can deliver compression to the collarbone as a result. And the most common problem that I see in shoulder blades is that it is sitting too low on the rib cage. So you could have some really good answers here in this program, because I give lots of exercises and techniques to fix this problem. And we'll see if it unloads the thoracic outlet syndrome for you. Now, another thing that could be contributing to this is posture. So if you have an excessively kyphotic posture, something like this, where the thoracic spine is really rounded, that can contribute to scapular dysfunction, which then also can contribute to the thoracic outlet syndrome. Well, where do I go from here? Well, you can go to fixingyou.com and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to fixingyou.com and join the interactive online clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.